India on Thursday, July 14, reported its first monkeypox case after the sample of a man hailing from Kerala who returned from the UAE 4 days ago tested positive. State Health Minister Veena George informed the media that the National Institute of Virology, Pune, had confirmed the disease. George informed the infected man has been isolated and kept under close observation. The person, a Kollam native, has been isolated for treatment at the Thiruvananthapuram Government Medical College Hospital. The health minister said the patient travelled from the UAE. He reached Thiruvananthapuram Airport on July 12. His friend in the UAE had tested positive for monkeypox a few days ago. His close contacts include his father and mother, and they have been kept under observation at Thiruvananthapuram Medical College. The symptoms of monkeypox were detected at the TVM.
Okay, a monkeypox positive case is reported, and he is a traveler from his UAE. He reached the state on 21st of this 12th of this month. So he arrived at Thiruvananthapuram Airport. And all the steps according to the guidelines issued by WHO and ICMR are being taken. And the health department, government of Kerala, has also issued guidelines on monkeypox. So at present the patient is quite stable, all the vitals are normal. And the primary contacts are identified: his father, mother, the taxi driver, auto driver, and the 11 passengers in the same flight who were in adjacent seats. So all the steps are taken.
George said that patients' close contacts like family members, drivers, healthcare personnel who attended to him at the first hospital and 11 persons who had occupied the seats near him on his flight from the UAE have all been informed about the new development. They will also have to go into isolation and monitoring for the next 21 days. The Kerala Health Department has taken all precautions to ensure that the infection does not spread outside the circle of close contact. All districts have been asked to enhance disease surveillance and monitoring, reported the Times of India. According to reports, the infected patient's condition was stable, though he seemed very anxious. He had first consulted a private hospital at Kollam after he developed fever and other symptoms. The man volunteered the information that his close contact in the UAE had been confirmed as having contracted monkeypox. The person had travelled on a flight wearing a face mask and clothes that entirely covered him, reported The Hindu. Further, Kerala Health Minister Veena George also assured the citizens of Kerala by saying that there is nothing to worry about or to be anxious about. All the steps are being taken and the patient is stable, the health minister said.
Nothing to worry about, there is nothing to be anxious about. All the steps are being taken and the patient is stable also.
Since early May this year, the World Health Organization reported that there were about 260 confirmed cases of monkeypox in 21 countries, which includes the US, the UK, the Canada, Australia, Germany, France, Italy, and several other European countries. As of June, around 2,100 cases of monkeypox have been reported from 42 countries since January. Most confirmed cases with travel history reported travel to countries in Europe and North America rather than West or Central Africa, where the monkeypox virus is endemic. This is the first time that many monkeypox cases and clusters have been reported concurrently in non-endemic and endemic countries in widely disparate geographical areas. In this regard, the World Health Organization said Tuesday that it will convene a second emergency meeting next week to decide if monkeypox poses a global health threat as cases rise to 9,200. The UN agency declined last month to declare a global emergency in response to monkeypox. But as infections have risen substantially over the last several weeks, the organization is expected to consider whether to issue its highest alert when the emergency committee reconvenes next week.